Time now for this week's Health Matters. Paul Critz at KFUG Community Radio, along with PA at Large in Delaware County, Lynn Szabo. Now, we record these on Sundays. Last Sunday, Lynn, you showed up here at the Fug House to record wearing scrubs. You were on your way to someplace else last Sunday. Where'd you go?
Right. I went to the Outreach Homeless clinic that they have kind of on the corner of Elk Valley Road and Howland Hills, so just down the road, kind of in the location of the old Gordy Bros.
Yep.
Is kind of the way I remember it. Every other Sunday, they're doing a noon to 5 clinic there.
Who's they? It's Open Door?
Humboldt Open Door Clinic. Our idea nurse, Maria, has kind of talked about it on and off. But they have a physician, local physician who works at the prison who volunteers for them, but was unavailable last Sunday. So I was the person who was doing it. Super fun.
Super.
Yeah. And it made me think we should probably talk about, medical care for the unhoused and how it's changed maybe since over the course of my career, so since the mid-'80s.
Okay.
Yeah.
Before we get into all of that, just give us an insight. What was it like there? What sort of issues did you see? How many people came through?
Super cool vibe. It felt more like kind of like a bunch of friends hanging out like around a barbecue, maybe, except minus the barbecue.
A little Sunday afternoon.
Yeah, people riding bikes through and dogs running around, and a lot of people yelling from the bushes. And at first, not very many people come out, and I think they send some volunteers out initially to kind of check the vibe out, and then it gets a little busier. Daphne was there, so homeless advocates are there. Open Door had me there, Nurse Maria, a couple of medical assistants. There were other kind of ancillary homeless helpers, I guess. So a friend formerly from my Sutter life, Jerry, was there. And it was like super cool. There was like coffee and cookies and clothing box to go through and a bunch of sundry things like, hand lotion and hand sanitizer and soap and shampoo and toothpaste and condoms, of course. And
who provides all of this? Is it all from Open Door?
Yeah,
Daphne
it's all from
also?
Open Door.
Okay.
Yeah, so Open Door has a big med room in their clinic here, and I would say about half of it is not prescription med, but kind of toiletries. And so they packed up some of that. It seems a little weird. I don't know where they get it, if it's just overstock and donations from merchants or what, but it's kind of cool. It was well received. So there were some chairs open and some tables and, various people coming to hang out for a while. It was good. I saw 14 people.
14 people, wow.
If you want to get to the medical stuff. There was no mental health person there, although that's on tap for the future. There was definitely a crew of nurses who were interested in wound care. There was a student nurse who's currently an LVN and is on her way to be an RN through the HSU program. So she was there kind of scoping out what community medicine really means. So that was cool. I saw what I'm told was a higher number of women. Probably because I'm a female provider, I would imagine.
But do you think it was a response to your presence being there just that day, that maybe more women came to seek health care from you?
Yeah,
That makes sense.
kind of think so. I mean, the word got out beforehand that I have some experience in OB and stuff, and so there was a woman who was pregnant there who was in her second trimester, headed for her third trimester, had not had any care. So we got her on things like prenatal vitamins and got her pointed in the right direction. I didn't have a Doppler, so I couldn't listen to the fetal heart tones or anything, but there's a lot you can do without that too. And there was a woman who was 1 week postpartum emergency C-section. So living in a place called the Swamp. Let me just throw that out there.
And the Swamp isn't a cutesy little name for like the tent and mash, right? It's a swamp. It's a wetland. It's wet. It's dense. It's green. Right. It's outdoors. 1 week postpartum?
1 week postpartum emergency C-section.
Oh my God!
Did not have her newborn with her, so I don't know the nature of that.
And I'm appalled that, like, regardless of what happened, what this woman's story was, that if any officials were involved at all, say with the birth of a child, I don't know, a week ago, that they wouldn't just kick this woman out into the swamp again, regardless of what they did with her child.
I'm not sure they kicked her out, but I'm also not sure they knew that she was headed toward the swamp.
Okay.
So that's what we talked a little bit before going on mic, actually, about, I think there's always been a large homeless presence there, and they're just super good at being under the radar.
Oh, yeah. No.
So they don't get hassled.
No, we're right around here. Yeah,
Right.
yeah. This is where we live, and there are homeless people present.
So I don't think this woman's stated intent when she left the hospital was to go to the swamp.
Okay, gotcha.
So something in her life kind of directed her there. I don't know what it was.
Wow.
So I saw lots of wounds, lots of MRSA, and it was kind of surprising to me. This is ongoing wound care, so I had culture results. So I had electronic access to people's charts for continuity care. And it kind of reminds me, like, maybe 15 years ago when MRSA first kind of hit this community. Everybody was like, oh, my God, MRSA, don't come near me. And now it's like, yeah, he's got
it's endemic, right? It's
got
just
a little MRSA. Yeah. No big. So that was kind of interesting. But people, the kind of medicine that you're doing on people who are unhoused is different. There's a lot of wound care. There's especially a lot of problems with kind of overuse injuries because people just keep walking all day, and they don't have properly fitting shoes or dry socks, and so a lot of times the foot wounds are pretty horrific. And they never really get time and warm water and soap to heal. So that was kind of interesting. Things like painful knees because somebody had a history of trauma, maybe has orthopedic appliances in their joints, and they develop arthritis around it just because they're always walking. There's never really a time to rest it. Wow. Actually, I bumped into one of my own patients.
Really?
So I told her how to get into clinic. And that's actually a big part of this is they're hoping that people go into clinic. But some super easy stuff like a refill of seizure medicine, 2 seconds, no big.
Right.
Stable person, that we want to keep her stable. Yeah. So it's not, and people are grateful, although they don't really, they kept thanking us and stuff, but it seemed like what we were doing was just kind of a little thing compared to what the need is. They need homes.
Yeah. It's interesting that you said this clinic is kind of seen. I mean, it's seen as sort of an intake, as kind of this is how we can get you into better access and more of the system like this. Yeah.
So that's a nationwide thing.
What do you mean?
So the way homeless care or the care of the unhoused used to be was that you got to get right with your sobriety, and then you can come talk to us.
Right. Work your stuff out, and then we'll be here for you. Yeah, so that has changed. You're right.
Epically not working. So in about 1985, there was kind of a drive, and they have a specific name for it. Let me see if it's in my notes here. But it's kind of a wraparound idea where they went from insisting on sobriety first to sending healthcare providers of all different kinds. So nurses, physicians, probably PAs and NPs, wound care specialists, mental health specialists, drug treatment specialists, and probably other allies, okay? Because they have to see a familiar face before they're going to think you're okay.
Yeah.
And they send them out into the streets. So this was urban, right? And they maintained a presence that was really consistent. So not every other Sunday, but like every day and through the night. And, they had vans that were stocked with stuff, and they just were always there. And as the people began to trust their reliability and their use to the particular unhoused community and the non-judgmental stuff, super important, then they kind of approached him for care. And then what the hope is that you can at some point have somebody's trust in you be to the extent where they will actually go into the clinic, that they have the means to get over to the other side of town, and they know they will be seen and not turned away after they walked all the way over there. And that it's not really going to be all about their meth use, but more about what's going on with their feet.
I wonder if that is, you talked about this coming out of an approach to homelessness in the mid 80s. And I know more recently too, there's just in recent years, there's been an increasing focus on addressing homelessness and dealing with the homelessness first. Dealing with, let's get you.
That's
let's
called
get,
Houses First.
Houses first,
Yeah.
right? And it sounds like the same sort of approach.
Yeah.
Yeah.
It's let's not like project what we think you need onto you, but let's give you what it is you really need.
'Cause
And then we can talk about risk management and eventually, get to a place of better health. Just being homeless is actually a healthcare risk, a significant healthcare risk.
Just like being from the zip code. Yeah,
Right.
exactly. So think if you're homeless and living in Del Norte.
Yeah. So there's 150,000 homeless people in California.
Which
that
is
was as of 2015. I imagine after COVID, it's gone up.
Oh, and I've seen updated numbers from that. But the takeaway is that the lion's share of homeless people in the United States are here in California.
Yeah. Life expectancy of a homeless person decreases by 12 to 20 years.
Wow.
So decrease in all-cause mortality, which is kind of sad. Specifically, though, they have higher rates of diabetes, hypertension, myocardial infarction, which is heart attack, HIV disease, hepatitis C disease, depression, substance abuse, COVID, and TB.
Now, not to break the seriousness of this, but I've watched enough shows. You don't have to keep clarifying what an MI is.
Right. Oh, I don't? Okay.
I've got
All right.
15 seasons of ER under my belt. I know what an MI is. No. So just right there, all of these conditions, these chronic conditions that can plague homelessness at a heightened rate, just illustrates the fact that simply being homeless is unhealthy, regardless of any personal sort of situations you have on or other factors involved. Just the fact that that's the context in which you exist, you're at a higher risk for these other everything from TB to depression to HIV to MI.
Yeah, and then when you get it, you don't do as well because you don't have access to care. So
Right.
there's that's multifaceted. So I think one thing that I would encourage anybody who's interested in helping, because I imagine some people out there thinking, get socks. Super easy. Socks are almost like I imagine what cigarettes are in prison.
It's like,
In the
okay, yeah,
swamp,
sure.
Socks are kind of like
Dry socks are like so,
probably
yeah.
the single most helpful thing.
Wow.
The feet, especially when it starts to rain, there's actually trench foot. I have seen it in Del Norte County.
Oh, man.
And usually then I ask the nurses to give that patient like a like a foot bath with special Hibiclin soap, which is special medicated soap, and then I always have to kind of remind them, that Jesus washed the feet of the disciples, because there's always that moment where they're like, really? I mean, because really...
Oh, like I got to touch this foot? Is that what they...
Yeah, it's probably... And it's sometimes you can smell the healthcare problems before you hit the room.
Sure.
Or just when you're in the hallway.
Right.
So rather than being grossed out, though, we should be, I think, horrified.
Yeah, right.
That somebody is in these conditions. The other thing I thought that was kind of interesting that I hadn't really noticed, there are a couple of things. These are not necessarily medical, but they might be, is that there was a bin of secondhand clothes that people were going through. And it occurred to me, and they were packing up lots of clothes. And it occurred to me, number one, if it gets cold, you might be wearing layers like that. Okay, not necessarily the Patagonia vest with, a wool sweater, but more like ladies' pajamas on top of, old T-shirts,
right.
and, et cetera, et cetera. The other thing, too, is what do you do when your clothes are dirty? I think you just abandon them.
That's why you see clothes everywhere out in the forest, right?
Right.
You can't wear this anymore. Yeah,
And all of a sudden, that, like from my housed worldview, that became like it clicked in. And I was like, oh, yeah.
That kind of make it, I mean, not that it wasn't real before, but make it more immediate for you then to understand.
Completely.
Yeah.
Completely. Like, and I think there's a lot more examples in general where perhaps somebody who's living in an unhoused area like the swamp has like a way different worldview about what they need. So that kind of reminded me maybe not to put my priorities over onto it. But anyway, the other thing too is there was some Starbucks coffee there. You know, those little cardboard carriers with a bunch of cups that somebody would bring to a meeting.
Right.
So, and it was right next to me. So I'm watching people prepare their coffee, like 10 packs of sugar are going in. Mm-hmm. And I think there's multiple reasons for that.
Yeah.
So they told me once that people who are using meth are kind of into sugar.
Okay.
But I also think that if you just got up, you know, from a cold night, that your body is probably asking for some fuel to
You're carbo loading with that coffee,
to try and warm it up a little bit and keep a stable temperature. And I never looked at it like that.
Right.
It was kind of interesting.
And that's what's available for them right there. That's the food source. Yeah. Do they still have the food donation cabinet out in front of the? Did you notice? Right next to the door, they had a wooden cabinet there at the market, and people would leave canned food.
I didn't notice, but it was referred to. But
okay.
I also noticed when I was working at Redwood Urgent Care and we were at the RHC building, and they were giving away food that oftentimes, you know, like half the box was left behind because what was in it was not practical for an unhoused person.
Yeah.
And like I would have thought like a can of soup would be a great thing, but how do you like cold soup?
Right. Cold. Yeah.
Especially after you've been cold all night and maybe you're wet and cold.
Yeah, exactly.
So
first off, you open it. You have to open it.
Right.
And then you have to deal with it. And then, a big mouthful of jelly, cold soup in the morning. Yeah. Sure. I have seen, and I've seen people come through and go through the box. I've seen people actually show up with things and like put something in the box and take something out. It seemed to work the times I'd seen that food box there. But yeah, that's a really good point.
Right.
Even just thinking, can of soup, that's great. Boom. No, that presents a whole set of possible issues and obstacles to somebody living in a swamp. Yeah.
And I don't know if it was Maria, but somebody made homemade chocolate chip cookies, gone in a hot second. And I think that goes back to the sugar thing.
Yeah.
Is that there's like this craving for sugar, which is more than just a bad thing. So that was kind of interesting. We stayed for a long time. They're kind of slow in coming out. You know, they sent a couple of...
And I'm sorry, what was the time? 10 to 2? Is that when it happens?
No, it was noon to 5.
Noon to 5, okay.
Yeah. And
right, because you were here that was
it. So, and in fact, I'm going to do it in the next Sunday. So after we're done recording next Sunday, then I'll trek on out there.
I have a pitch.
Yeah.
Let's see if we can do it next Sunday. Yeah. I'd like to come and do a piece. Maybe next Sunday, come and at least interview you, or if Maria's there, some of the people, you know.
Oh, sure. They'd be all for it. I think there's going to actually be the medical assistants are talking about having a hot dog barbecue.
Oh, okay.
Bring a side, but it's not next Sunday. It's the Sunday after, and I won't be there not the Sunday after, but 2 Sundays after. So I assume that's weather dependent, but let me get more information for you. I don't know if that would draw people out more.
Or not, or get in the way, or keep people away. I certainly don't want to do that. But I think what's going on there should be highlighted. I think it's a beautiful thing.
I know. I was surprised how... I don't know. It felt like being at university and hanging out on the quad.
Yeah.
The only thing that lacked was a frisbee.
Frisbee, right?
And a house, you know.
And a house, right, right.
So super chill.
So, I mean, it seems like you had mentioned before, and I don't know if you want to go into this, because I'm curious about this, about experiencing some sort of like a NIMBYism.
Yeah, I do want to mention it because
in regards to the clinic up the road.
So when I kind of mentioned to my colleagues that I was going to be doing a show about my experiences at that clinic because I found it to be really positive, there was a minor teensy little bit of grumbling from somebody who lived out there that said the feeling was that this was an attractant. For homeless people, that the people who lived there were not super happy about being there. And then I tried to say, well, tell me what it is, or let's sit down and talk about it. Right. And it wasn't the right time in clinic. Okay, so I don't think she was dodging me. I think it was just not the right discussion for that moment. Sure. However, she did mention that she thought that the population of people, of homeless people in her area was going up because of this draw, is what she saw it as. Now she's a nurse, all right? So, and I know her. I've known her for 30 years. She has an amazing heart, but and she has washed the feet of the homeless. I've witnessed this. However, she seems to think. I think she just didn't notice they were there all along.
Right.
And I find it really hard to believe that, the people in, let's say, Humboldt County are like, hey, here's the scene. Come on up.
Yeah. How difficult could that be? Oh, I want to get up to Del Norte to be homeless because I heard every 2 weeks there's a pavilion and a van sitting up here and I can get health care. I know that
I don't think that's happening. I think they're just more apparent.
Yeah. Or maybe it is a draw just in the area, in the swamp, if she's getting more people into her part, just because they're coming for the thing. But it's not like they're trucking in from elsewhere.
Yeah.
Huh.
So I think it would be interesting to know if somebody has some concerns there about it, because I imagine, like, if I was living there, it's possible I would have a different view of it. I don't know.
But what would have to happen for you to have that different view? It's not just something, I see more homeless people. I mean, here where we live, things go missing, gas gets taken, all kinds of things.
Right.
But I don't necessarily connect that to.
It would really have to wound me, and I'm kind of in a different position. So that the bar for like really wounding me is not the same as the bar for everybody else. So if somebody ripped off a tank of gas, I could recover from that.
Right.
But somebody may not, and I don't have kids just schlep around, or I don't, I don't depend on my transportation to commute out to Smith River every day, although at times I do. But you know what I'm saying?
Yeah.
I can recover from that. These guys are not recovering from the things that are happening to them. They really aren't.
I don't know how we can get away from like the way care and interaction and service providing for homeless people and anybody, how it used to be where it's like, get your sobriety straight, get this straight, do this, and this, almost as if you needed to prove you're worthy of the assistance.
Right.
And I like approaches that kind of take that away. No, let's address the issue first. Let's get you in a stable place, and then you can address your issues and take care of that. But it's much easier to deal with the addiction or trauma, mental health issues if you at least are out of the rain and have a roof over your head. I appreciate that kind of approach. But how can we, as it seems we sort of slowly turn the tanker in that direction, how can we get away from that judgment? That looking at somebody, coming out of the swamp who's obviously having a thing, coming out, talking to themselves, dealing with whatever, looking for food, looking for money, how can we get away from looking at them as being lesser and less deserving? That seems to be the kernel at the base of NIMBYism.
Are you asking me as like a resident of Crescent City, or are you asking me as a healthcare provider? Because there's probably two different answers.
Oh, okay, let's start with the healthcare provider.
Healthcare provider, it's really easy for me to draw down and see a foot problem. Okay, and if this is a patient-centered model that we have, then dealing with the foot problem, because that's what they came to me for, and I don't have to. If something else comes up in the course of dealing with the foot problem, then, maybe it expands. But usually that's what they're asking, and that's how I'm addressing.
Okay. But not a lot of not all healthcare providers do that, though.
Sure, and it's one of the reasons it's hard to get people to stay up here, because they're not like enthused with the population up here.
Right.
But actually, I find a lot of, how to explain it? I have lived around homelessness. I've never been unhoused, but I have seen people make what looked like an incredibly bad decision to me, but in the context of their lives was actually brilliant survival.
Okay.
So I think there's a lot of deals that happen, and I'm out in the weeds again, but I've been there a little bit, so maybe I always wondered why I had those experiences in my life, and I think it's what I bring to my medicine, and it's actually one of the tools that I've learned, and it's more helpful now.
What experience-based empathy? Is that what you're describing?
Yeah. So, white privileged girl from Los Gatos had episodes in her life before she was in medicine that made her think of things in a different way, is what I'm saying. So, but I also like, there was a unhoused person down at Front Street whose pit bull attacked my dog, and I was sure pissed about that.
Yeah.
Okay. Yeah. And luckily some pepper spray and my dog's okay, but it depends on where you're attacked and what the situation is.
I guess. Yeah. It seems like such a problem and such a systemic problem to sort of take that personal experience out of the issue and look at it as, I guess, not a more faceless, but a more universally applicable situation, and not maybe judge people based on individual experiences you may, or realizing that your individual experiences don't necessarily have to typify an entire demographic of people. It's just, it's a challenge. It's a challenge. It's a challenge living here on this road. It's a challenge at night when I hear people screaming and walking up the road. It's a challenge when somebody comes walking out of my backyard and comes walking through, and I'm like, hey, who the hell are you? Yeah. I have a thing that I learned. There was a woman, we called her the ghost. She's not around anymore, but for a number of months, she kind of haunted the property here. And I just see her out a window walking by one of the houses here, and Persephone the same thing, and she'd come up on our back deck and take stuff and go things. I found some of our items that were on our back deck off in the woods over here. I just found them, and I took them, brought them back, and I wanted to be compassionate.
Right.
I wanted very much to not be NIMBY. And I'm not that kind of guy. I don't feel like I'm that kind of guy, but I'm standing out on the back deck at night, and somebody comes around the corner and starts coming up the deck. My reflex was yelling and loud and in their face and get the F off my property before I could even register what was going on. And so there was this reflexive issue with, oh my God, I'm that guy. Inside, I'm like, no, get away from my stuff.
Right.
That was a surprise to discover, and maybe a lot of people have that in them and they don't know.
Yeah, it kind of depends on the situation. We try and protect our own, and we want to, we don't want. We want to be able to maybe support somebody in need in the way that we want to do it. And not being like volunteered for it.
I guess that kind of circle the wagons, NIMBYism, get off my lawn sort of thing. I guess what surprised me was how reflexive it was. It wasn't a conscious decision. It wasn't a policy issue decision. It was something just, what? You're in my stuff. You're in my face. Get off my property. I can hurt you if I need to. Right. And I didn't stop and go, oh, this person has issues. This person has a lot, probably her feet are wet, and she's looking for some, it's amazing and disheartening how quickly that kind of higher level thinking.
It is, and I could totally see myself doing that.
Right, yeah.
Yeah, get the, like when my dog was threatened, there was a lot of swearing. Yeah. There was a lot of immediate up in the bodily threat, with pepper spray and stuff like that. And it was witnessed by a bunch of people around. It wasn't like it was that dark at night or scary or anything, except for my dog. So yeah, we respond if we perceive a threat to ours. Yeah. But these guys have tons of threats. They're victimized constantly. And I'm not certain how to solve that problem, but I know how to treat trenchfoot.
There you go. And maybe that's where it should start.
Where what I'm going to do next Sunday.
Right.
So, but I think this is a good thing that Open Door is doing. They got grant money for a van. They're going to expand on it. So, I think there's going to be like pop-up clinics. Which sounds like super fun. just
in other locations where they can get
just kind of randomly have a circuit, and they're hiring a regular provider for that, and that's kind of exciting. And they'll have nursing staff for that. That I will tell you, the medical assistants and the nurses and the students are all about doing that, because it's way funner than being in clinic and listening to all the things that happen in the course of a day at the clinic, it's something new and exciting. And I know that they'll have that van really tricked out. I'm told that I could do a pelvic exam in that van. So, I imagine, I think they're trying to develop a women's healthcare presence. I think that's why that got brought up. But I think what they need is wound care. And like a tetanus shot, to get a guy who needed a tetanus shot was a momentary deal, but it was solved. Thanks, Maria. Yeah. And I think that this has been used successfully in Humboldt County, and you're going to start to see it up here. My guess is probably during the rainy season.
Right on, when it's needed most. Good.
Right.
Okay, well, I'm going to tag along next Sunday with you if it's okay.
That would be super fun.
Cool.
I'll give you Maria's contact information. You can just let her know.
Great.
So, yeah, it's super chill.
Okay, so before we go, because we have reached the time limit here, I wanted to suggest something, and it doesn't have to be for next week, but there's something that I wanted to kind of a little exchange I had with a guy. Perhaps you know him, Gordon Clay. Who's he's a mental health advocate, and he works out of Curry County, and he comes down every year during September, October for suicide prevention season, things like that.
Nice.
And comes and talks. And he's a very, very compassionate guy, very, very dedicated to what he does. We were having a conversation about all of this and about suicide prevention and mental health, specifically in rural America. And he said something that made me go, huh? It was... because he's working out of Curry County, and he says, there's one thing I want to say about California and mental health care. You guys are doing it right.
Oh, really?
Yes.
Oh, my God.
Yeah, that was my reaction, too. And just compared to Curry County. And he was then he started talking about taxation levels and what sort of infrastructure and resources are available in southwestern Oregon, and then from the state in general and across the state. And he painted such a glowing picture of what California is doing and what our local school district is doing. And
good.
Really? So I don't know.
That's so good to hear.
Yeah. And if there's just some way in the future, if we could investigate that idea and just kind of get some context as far as even just the communities right around us, because Southern Oregon sounds far away. It's a whole other state. It's 20 miles that way. We're in the same region. They're much worse off than we are here. That's what he was saying. And I'm like,
interesting.
I'm so used to thinking of California as just almost a failed state in this regard. But no, that wasn't his take on it. So,
well, that's super cool. So if we're getting kudos for what I think is a low bar.
Yeah, right.
Yeah. Oh, my God.
What would happen if we did it Szabo style, right?
Yeah. No.
All right. Well, just food for thought for perhaps a future
I think
episode.
I know who you're talking about. He's brought us information in teen clinic.
Mm-hmm. Yeah. He walks around. He takes the "Are you okay?" stuff around.
Right, and he's had a lot of work with teens, so that I was kind of surprised. Yeah. So anyway,
well, all right, Lynn. Thank you so very much. I guess I'll see you next Sunday before the clinic.
Yeah, Mike from Walmart.
Oh, is Mike coming in next Sunday?
But he's coming in as an individual.
Not Mike from Walmart, just Mike the pharmacist.
Mike the pharmacist is coming in to talk to us about, there's been a meltdown of pharmacies. And I actually think it could be extrapolated probably to other rural communities. I don't think we're unique here. Okay. And let's get his take on it.
Great. It's always interesting hearing from Mike. So Mike Anderson next week on Health Matters. Lynn, thank you very much.
You're welcome.